Understand opioid dependence and how Vivitrol together with counseling may help. To understand how opioids affect your brain, it is important to understand how the normal functioning brain works. The human brain is stimulated by everything you do. When you engage in an activity, your brain releases chemicals that impact your mood and feelings. When the activity is something you enjoy, your brain releases chemicals called endorphins that make you feel good. Endorphins attach to opioid receptors, much like a key fitting into a lock, and unlock the receptors. When the receptors are unlocked, they release a chemical called dopamine in your brain. Dopamine gives you a good feeling to reward you for doing something you enjoy. This reward is what makes you want to repeat these behaviors. When you take opioid street drugs such as heroin or opioid pain medications, for example, Vicodin, Percocet, and OxyContin, they attach to the same receptors, opioid receptors, but in a way that results in the release of greater amounts of dopamine. This increased amount of dopamine released in your brain produces pleasure that can be more intense than your brain's natural sensations, also known as a high. Many factors influence whether people will develop opioid dependence or addiction. Individuals who continue to use opioids and become dependent likely do so, in part because of the intense feelings of pleasure they can cause. Opioid dependence is a chronic brain disease with physical and psychological effects. Vivitrol, naltrexone for extended-release injectable suspension, combined with counseling, may help you move forward in your recovery process. Please see important safety information below. Please see Vivitrol medication guide and prescribing information on this website. Discuss any questions you may have with your doctor. Vivitrol is a prescription injectable medicine used to prevent relapse to opioid dependence after opioid detox. You must stop taking opioids or other opioid-containing medications before starting Vivitrol. Treat alcohol dependence. You should stop drinking before starting Vivitrol. Vivitrol must be used with other alcohol or drug recovery programs such as counseling. Vivitrol may not work for everyone and has not been studied in children. Do not take Vivitrol if you are using or still have any symptoms of physical withdrawal due to dependence on opioid street drugs or opioid-containing medicines, have opioid withdrawal symptoms, or are allergic to naltrexone or any of the ingredients in Vivitrol or the liquid used to mix Vivitrol. See the medication guide for complete information about opioid withdrawal and the ingredients in Vivitrol and the liquid used to mix it. Vivitrol works as a blocker, fitting into the same receptors in your brain and preventing opioids from attaching to them. Naltrexone, the active ingredient in Vivitrol, does not activate the receptors. Even though Vivitrol blocks the intense high from opioids, it should not prevent good feelings that come from other naturally pleasurable activities. Vivitrol uses special microscopic balls to slowly release the active ingredient naltrexone. The body breaks down these balls slowly, which release the naltrexone over a 1-month period. Therefore, you only need to receive a Vivitrol injection once a month. When added to counseling, Vivitrol may help you move forward in your recovery process. Please continue to watch for additional important safety information for Vivitrol. Before you receive Vivitrol, tell your healthcare provider if you have liver or kidney problems, use or abuse illegal drugs, have hemophilia or other bleeding problems, have kidney problems, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if Vivitrol will harm your unborn baby, or are breastfeeding. It is not known if Vivitrol passes into your milk or if it can harm your baby. Be sure to tell your doctor if you have any of these other conditions before you get Vivitrol. Tell your doctor about all the medications you take, including prescription and non-prescription medications, vitamins, and herbal supplements. Especially tell your doctor if you take any opioid-containing medications for pain, cough or colds, or diarrhea. Be sure to read and understand the medication guide before starting treatment. Vivitrol can cause serious side effects, including risk of opioid overdose. Using opioids, even in amounts that you used before Vivitrol treatment, can lead to accidental overdose, serious injury, coma, or death. To avoid accidental overdose, do not take large amounts of opioids or try to overcome the opioid-blocking effects of Vivitrol. Do not use opioids in amounts that you used before Vivitrol treatment. You may even be more sensitive to lower amounts of opioids after detox, when your next Vivitrol dose is due, if you miss a dose of Vivitrol, or after you stop Vivitrol treatment. Get emergency medical help right away if you have trouble breathing, become very drowsy with slowed breathing, have slow, shallow breathing, feel faint, very dizzy, confused, or have unusual symptoms. Severe reactions at the injection site. Vivitrol may cause severe injection site reactions, including tissue death. Some injection site reactions have required surgery. Call your doctor right away if you notice any of the following at your injection site: intense pain, the area feels hard, swelling, lumps, blisters, an open wound, or a dark scab. Tell your doctor about any injection site reaction that concerns you, gets worse over time, or does not get better by 2 weeks after the injection. Sudden opioid withdrawal. To avoid sudden opioid withdrawal, you must stop taking any opioids or opioid-containing medications, including buprenorphine or methadone, for at least 7 to 14 days before starting Vivitrol. If your doctor decides that you don't need to complete detox first, he or she may give you Vivitrol in a medical facility that can treat sudden opioid withdrawal. Sudden opioid withdrawal can be severe and may require hospitalization. Liver damage or hepatitis. Naltrexone, the active ingredient in Vivitrol, can cause liver damage or hepatitis. Tell your doctor if you have any of the following symptoms of liver problems during Vivitrol treatment: stomach area pain lasting more than a few days, yellowing of the whites of your eyes, dark urine, or tiredness. Other possible side effects. Vivitrol can cause other serious side effects such as depressed mood. Sometimes this leads to suicide or suicidal thoughts and behavior. Tell those closest to you that you are taking Vivitrol. You or those closest to you should call your doctor right away if you become depressed or have any new or worsening depression symptoms. Allergic pneumonia. Tell your healthcare provider if you have shortness of breath, wheezing, or a cough that doesn't go away. Serious allergic reactions. Get medical help immediately if you have a skin rash, swelling of your face, eyes, mouth, or tongue, trouble breathing or wheezing, chest pain, or are feeling dizzy or faint. Common side effects of Vivitrol include nausea, tiredness, headache, dizziness, vomiting, decreased appetite, painful joints, and muscle cramps. In addition, common side effects in people taking Vivitrol for opioid dependence also include cold symptoms, trouble sleeping, and toothache. There are other important things you should know about Vivitrol. Please talk with your doctor to see if Vivitrol may be the right option for you. Be sure to read and understand the medication guide prior to starting treatment with Vivitrol.